the sugar solo. Now, Monday I might be challenged on my side. Would you watch the screen?
Yes, sir.
Thank you. And will the department officials also join us yet on Monday?
Yes, sir.
All right. Hey, give me an indication when the minister has joined. I'll just give another 2-3 more minutes, please. Do you know if the minister is in yet on Monday?
I can see her chair, but she is in the lobby, and I tried to admit her, but I don't know what is going on. I think maybe it's connectivity or something.
Let me try if I abuse my powers here and try to admit.
Morning, everyone.
Morning, Benedicta. I see the two of us were multitasking as of after 7 this morning. Siraj, can you try probably to admit the minister?
Okay, sure, I'll try now.
Yeah.
I think the minister might need to leave and rejoin because it's not allowing.
Okay, I'm gonna try to give her a call. Minister, here. Well, thank you. I believe we're struggling to admit you. Yeah, the leave and try. Yes, please do. Thank you. Bye. All right, Siraj, on Monday, can you guys try again? Got the minister on the line.
Suraj,
Yes, I'm just waiting.
perhaps maybe you can call her to the meeting.
No, she's external.
morning, Siraj. Good morning, Siraj. The minister is saying she can see that she's in the lobby. Go to live, minister.
Strange, it's not reflecting here as yet.
It's a sign. Minister, you're not reflecting. We now check.
Oh, there we go. I see she's in already. No.
Okay, hang on, minister. They can see you now. Okay, Siraj, yeah, the minister's going to join. There you, minister. All right, thank you. All right, good morning, members, and good morning to the officials, and good morning to our guests. If there are any guests on the platform, thank you, and thank you for your patience. It is now 5 minutes over 8 o'clock, and this meeting is scheduled to be an hour and a half. So we will try our best be within the confines. And thank you. And we all know the drill. The meeting is officially open. I'm going to allow for the members, for ourselves, to introduce ourselves for the record. And then I'll give over to the minister and her officials to introduce themselves. And then we will proceed from there. I'm Emery Boyson. I'm the chairperson of the Standing Committee for Health and Wellness.
Good morning, Chair. I am Leon van Wyk, a member of the Standing Committee on Health.
Good morning, Chair. I'm Donita Stevens, and I'm a member of this committee.
Good morning, Chair and everyone. My name is Rachel van Vogel, and I'm a member of the Standing Committee.
Hi, I'm Thomas Walters. I am a member of this committee.
My name is Benedicta van Minne, and I'm a member of this committee.
Member Jacobs. You may go ahead, Member Jacobs.
My name is Dwayne Jacobs. I'm a member of this committee.
Thank you, Member Jacobs. Melissa, I'll give over to you and then to your team.
Thank you, Chair. Good morning. Mireille Wenger, Provincial Minister responsible for health and wellness in the Western Cape.
Good morning, Chairperson and the committee members. I'm Keith Clutie. I'll introduce the department officials. I'm the head of department. We got Dr. David Pienaar. He is a public health specialist with our rural health services. Mr. Garth Hankey is with Grootskee Hospital. Mr. Glenn Carrick is our Chief Director for Financial Management. Ms. Karen Ching is our Director for Strategic Planning and Strategy. Ms. Karen Hausen is the Finance Manager for the Metro. Ms. Leslie Shand is our Acting Director for Health Intelligence. And then Dr. Sadi Karim is the Chief of Operations. There's an apology from our Chief Financial Officer who's committed in a meeting with the Minister at National. Thank you, Chairperson.
Minister and Dr. Clute, thank you very much for that. Colleagues, we are now officially going to deal with the matter at hand. But before we do that, please allow me to make my opening remarks, and thereafter I will give over to the Minister and then to the HOD. Colleagues and members, as we're all aware, the task at hand is for me to table vote 6. And after that, we will deliberate on the matters regarding vote 6. But the first thing that I have noticed, and I think we should all appreciate as members, we are very grateful that we've noticed that there's an increase in vote 6. We appreciate that, and we know that that would go a long way to a department that is already being stretched. And also, members, I'm sure that you might have noticed that this vote has got more annexures than the majority of the other votes, which then might probably affect our time that we scheduled for this meeting. But in that case, what we will then do is that when we deal with resolutions, we can include some of the matters that we would like the committee to deliberate in the committee meetings going ahead, just for us to do justice to this big task in front of us. But what I would then propose, colleagues, is that from page 101 up to page 121, we can deal with the pages page by page. And then when we get to the annexes from page 122 to 154, if there's any matter that members would like to touch on, is to refer to that, but taking time constraints in cognizance, then we would then proceed accordingly. But what I'm also going to do now is that I'm going to allow for the minister to make some opening remarks, and after you, Minister, to Dr. Klute as the HOD to also make some opening remarks, if any, and then thereafter I will give an opportunity to the members once more to have any follow-ups with relation to the opening remarks. So, Minister, I'm going to hand over to you.
Thanks very much, Chair. Good morning to you and the honourable members. We're here this morning to present the adjusted appropriation budget for vote 6. The members will see that with the shifts environments, we see a total additional appropriation proposed of 197.7 million rand. We have presented to the committee recently on the budget pressures. So the committee is well acquainted with our budget pressures, most notably on the goods and services side, and which this additional allocation is very welcome to alleviate those in-year pressures that we're experiencing, and in particular on the goods and services side. So with that, just some very brief opening remarks. I'll hand over to the HOD to build on that, and we look forward to taking questions and comments from the members. Thank you.
Thank you, Minister. Over to you, Dr. Klute.
Thank you very much, Chairperson, committee members. Just to take a little bit further, because of the movements and the net increase of 197 million added to our pressures to the department, you will see that that money mainly offsets the pressures in our big service areas. So when we talk about Program 2, that is our district health services, we divide it between rural and metro. So there's some money that's offsetting specific pressures in that area. And then the other bulk of the is in Program 5, which is our central hospitals. So that's the pressures in Groot Schuur, mainly Groot Schuur and Tygerberg, but also in the Red Cross Hospital. Then there are other internal environments, and then there are some money that we are actually shifting to other votes in terms of pressures, like giving money to CEI for computer refresh and items like that, something to infrastructure for offsetting some of the things we do. But the balance of all of that is 197. And just in the bigger scheme of things, we were projecting 200 million projected over expenditure towards the end of October. This additional money helps us, and that will help us to break even within this financial year. And just to describe that to you as well, there is a process of us now going on filling significantly post until the end of March. And obviously the carry through of this budget then goes into the budget for the future year. But all the details are in the schedules. We're very happy to respond to any of them. Chairperson, thank you very much. Chairperson, you're muted, sorry.
Thank you, HOD, for that. Members, I was saying that any comments based on the opening remarks of the Minister and the HOD? I don't see any hands. Going once, twice, thrice. All right, members, we're now going to deal with the nitty-gritties as tabled in front of us. On Monday, if we can then just go page by page. And members, you may indicate by raising your hand if there's a matter that one would like to engage on as per the pages. Member Van Wyk, I see your hand.
Yes, good day to Minister and to HOD and to the team and to the rest of colleagues with us today. I think as Dr. Kluti has indicated, there are fairly big amounts on goods and services. I think on page 102, we talk about 275 million additional appropriation. And then on machinery and equipment, 119, almost 120 million are the biggest recipients. And then the biggest offset against that really is compensation of employees. If you could possibly explain that, then I think that would help us with a number of the matters before us. Thanks, Chair.
Thank you, Member Van Wyk. I see the hand of Member Van Vogel. Member Van Vogel, you may go ahead.
Thank you, Chair. Let me start by saying, while we are really eager to move forward, I'm really concerned that rushing this critical department may lead to a tick box exercise. And this is for me unacceptable, given the importance of this department's work. But nevertheless, Chair, let me thank you for the opportunity, and I also want to welcome the MEC and her team. And it's always valuable to engage with them because this department is a very critical department and important department. Chair, firstly, I would like to acknowledge the 197 million increase in the department's budgets, which is appreciated. However, I see clarity on the point made by the Finance MEC in a budget speech. She mentioned they are allocating 230 million from the Provincial Revenue Fund. Further, they are earmarking 193 million provincial equitable shares with the department infrastructure budget allocation to provide further maneuverability for the vote. If possible, could the department provide more details on these funds? Because I want to understand how these allocations reflect in the current budget and what specific areas or projects will these funds be directed towards? And what does the unearmarked of the 193 million mean for service delivery? What are the implications for the infrastructure priorities and which projects and in which hospitals are affected by these decisions? Then lastly, Chair, on page 104, sub-program district management 2.1, sub-program 2.1. Could the department also provide more explanations for this? Is this excess money available? Is there underspending in the VPU? So if I can get more details on that issue. Thank you, Chair.
Thank you, Member Van Vogel. Member Van Vogel, your comments, I take note of it in terms of the limited time, but what I can assure members is that within the hour and a half, I've seen it in other committees, we will try our best to ensure that we don't rush the engagement so that we can optimally use their time. And as I was saying, if we really can't get to the nitty-gritties, we will put some of that in the resolutions for further follow-ups. I don't see any other hands. Are there any other hands? Member Van Vogel, I think your hand is still raised. I'm now going to give over to the department to respond.
Thanks, Chair. I'll take the first go at it. Thank you very much to the members for the questions. As Honourable Van Vogel noted, in the Finance Minister's budget speech, the department was allocated 230 million rand. Of that, we will shift some of that to other departments for services. So, for example, to the Department of the Premier for some IT equipment and licensing and so on that we need. So when we look at all the shifts and environments between from our vote into others for services that they render to our department, we left with the 197 million, which is what you then see on the books today. Then the Treasury unearmarked our infrastructure budget in relation to 137 million to give us additional maneuverability if it is needed. So if we see as we go along in the financial year that we're not able to, even with this additional appropriation, meet those goods and services pressure, we now have a bit of flexibility to take some funding that was intended for infrastructure that we could then use elsewhere in the vote. So it's a kind of a contingency, if I could call it that, should we see that going into the latter part of the year, we need a bit of that flexibility. Maybe I could just ask the HOD to come in to further expand on these things and also on the COE offset, bearing in mind that we have very stringent rules and regulations now from the DPSA in being able to fill posts, which has significantly slowed down our ability to fill positions, even for those posts that are funded. And what this meant is that our COE budget for those posts that are funded kind of slowed down, and that then offsets to some extent in the goods and services and machinery equipment side. And with that, let me hand over to the HOD.
HOD, over to you.
Thank you very much, Chairperson. So to Member van Wyk's specific question, and the Minister went there now. So Member van Wyk, we have an allocation for COE. So based on how many posts we have filled at any given time, we then project how much money we're going to spend till the end of March against our COE budget. So two things have happened during the financial year. The first one is we've had a higher than expected attrition rate. That means more people resigning than we would have expected. So therefore our rate of, and then coupled with that was because of this austerity, your process to be able to fill a post has been constrained, and that's constrained across the whole of government. So we have a constraining set of rules about filling posts, and we had more people resigning than we expected. There are many reasons why that more people resigned, one of which is the two-pot system, and that's the impact. So we're analyzing all of that. But between the months of July, August, and September, we've had a higher than normal and expected attrition. It's stabilized a little bit now. So when we say we're starting to fill posts again, we're advertising, we're filling posts. But you can imagine if a post that we have money for is vacant for 4 months, we're not going to spend that money against that post. So the shift of COE that you see is then a shift to offset additional machinery and additional goods and services pressure. So that's the shift you're talking about. So in addition to that, we brought in the additional allocation, which then also goes into machinery and to goods and services. So as you rightfully say, between those three, there's money coming in, there's money internally shifting, and therefore most of it goes to goods and services and to machinery. The Minister has explained to the question of Member Windvogel. The issue is, Member Windvogel, when you ask about 2.1, and it repeats itself in other places, it's also in Program 1, there are amounts of money that we are allocating to other votes for work done in this area. So part of the violence prevention shift, it's a similar issue, that there's posts in the violence prevention that were exactly the same as posts elsewhere. So as much as we had the money to fill all the violence prevention posts, and it is being filled, there is still a little bit of a lag because some posts took a little bit longer to fill. And some of that money is then used in goods and services in other departments to help us with the violence prevention work. So that, in a nutshell, Chairperson, explains the questions that were posed to us. Thank you.
Thank you, HOD. Members, any follow-ups based on the answers given? I don't see any hands. Going once, twice. Mone, if you can then just go page by page again. Member Van Vogel, your hand is up. You may go.
Fine.
Member Van Vogel, yes, I note you.
Oh, sorry, Chair. I realize I'm still muted. No, it's for new question. Am I correct?
Yes,
Because
you're correct.
I don't have any follow-up.
Okay, new question you may. Just refer
Yes,
to the page.
Yes, thank you, Chairperson. Mine is on page 106, Chair.
Thank you. Go ahead.
Subprogram 5.1, referring to the Central Hospital Services. I have two questions on that page, Chair. One, what I notice is over 57 million is being reallocated, with the explanation being realignment of the main budget funding source to align to the business plan in relation to voted and national tertiary services grant funding within Groote Schuur and Tygerberg Hospital. Could you clarify what this means in practical terms? What does this realignment involve, and how does it affect service delivery or operation in these hospitals? Then secondly, Chair, the 101 million of compensation of employees funding is being reallocated to goods and services. I think, if I'm not mistaken, the HOD touched on this issue, but the stated reason is saving realized due to ongoing impact of DPSA Circular 49 of 2023 related directives. So all related to the implementation of control measures for managing fiscal sustainability during the process of creating and filling vacant posts in departments, as well as the required adjustment to the block advert policy. Could you explain, HOD or the Minister, could you explain this in more detail, especially how many posts are affected by these measures and what is the anticipated impact on staffing and service delivery? Lastly, Chair, we hope that when challenges relate to staff shortage are raised in the future, the department does not deflect a blame game. These adjustments suggest that vacancies are not being filled and the funds are instead being redirected for example, to fund the replacement of condemned medical equipment at Groote Schuur. Could you provide insurance on how the department plans to balance these priorities without compromising essential services? Then lastly, Chair, on page 107, subprogram 6.5 training, if we can get an understanding of how many nursing posts were affected by this decision and what measures were implemented to achieve these savings. And could you also clarify whether these savings were results of delay recruitment when it comes to vacancy or other factors? Let me park there for now. Thank you, Chair.
Thank you, Member. Member Van Wyk, you're next.
Thank you, Chair. My question just relates to the emergency medical services, which there's 15 million that has been being shifted there to partially fund in-year service delivery pressure. That's on page 109 in the middle under program 3. Perhaps if we can just get some indication there, if that will assist the anecdotal comments of those services being under pressure. Thanks.
Thank you, Member. Minister, you may delegate, but with your hands. Thank you.
Thanks very much, Chair. I'll take the first go. As the HOD explained, on the COE side, there's multiple things that have happened. In the one, we've had to freeze posts, as the committee is aware. In the second, we had a higher than normal attrition rate, where more people resigned than normal. We're looking into those reasons, and I think we have some insights into why in 2 or 3 months in particular it was higher than normal. And then that overlaid with much more stringent requirements to advertise. Now, I'm sure the members can appreciate in a very big system like the Department of Health, which has 30,000 employees, there is quite a lot of churn. There's a lot of people retiring, resigning all the time. And those we have to then fill those positions. With these regulations, it makes it much more tedious and longer to fill those posts. And so those kind of 3 elements together meant that even where posts were funded, it took us longer than normal to be able to fill them, plus a higher volume of what had to be filled. And that's kind of why we're in the situation. We have taken various steps to try and within the regulations make it as efficient as possible. But one can appreciate that the volumes are so vast that in this department it ends up being quite an issue. But as the HOD said, we're really doing everything we can to fill those vacant and funded posts right now. Also, as a result of this adjustment appropriation, we have a kind of confirmation that on the goods and services side, we will not be in a position where we'll be overspending. And then that helps us to make other budget decisions on the other side. I'll then just ask the HOD if he could expand on that and on the further questions on the nurses' posts and the EMS, please.
HOD, over to you.
Thank you very much, Chairperson. So just to reiterate on the first question that Member Van Vogel asked, and the Minister went there. So just to reassure, the message here, Member Van Vogel, is we are doing everything in our power to fill the posts. So we do not save money on vacancies and stop filling posts to spend money in other areas. So that's the message. You will hear that message from us when we come for the main vote for 25 going forward. But because of the factors, and the one factor that the Minister raised with you is the stringent DPSA process of filling posts. But there's a specific thing for a big hospital like Grootskeur and a big hospital like Tygerberg. And it is something called the block advert. Now, we've had that for many years. A new regulation from DPSA took away our ability to do a block advert. Now, just explain what the block advert is. For production posts. Now, you can imagine how many doctors and how many nurses must work at Grootskeur and Tygerberg. What we did in the block advert is we open an advert that says for entry-level nursing posts, the advert is always open, and as new applications come in, we are able to fill posts. That's the way we've been filling posts up until the DPSA regulation took that away from us. We're no longer allowed to use the block advert. So if like 10 nurses now resign, we can't just take 10 new applications that came in and process and fill the post quickly. We now have to go and advertise each of those posts individually. And we have to advertise it nationally. So now instead of us just working and filling posts as they come, it means we have to do an advertising process individually as the post goes vacant. Plus now process thousands of applications. So there's a complete slowing down of the process just on that one statement that says the block advert has been taken away. What we've been writing, and Minister has now written, and we're writing to DPSA to say, our understanding is we need to now use the powers we have to streamline our process for filling posts. So I'm just using that as an example to explain to Member Van Vogel that specific issue. We're putting everything in place. to enable us to fill posts as quickly as we can. That unexpected bump, we analyze it, the minister said, and we're also coming over that. But that leaves us with the reality that you come into October, November like we are, and we know because of those factors, we are not going to be able to spend against the item compensation of employees. That's why we move the money to offset pressures in other areas, but it's not that we're reprioritizing against posts. I think it's just important to put that into context. The specifics that she asked about the NTSG on page 106, Member Van Vogel, that NTSG, which is the National Tertiary Services Grant, it's one of the things that we get money into our central hospitals. It comes from voted funds, but actually the main source for Grootske Tafelberg and Red Cross actually comes from a conditional grant. Now, for voted funds, we can use the money shifted. But for conditional grant, there's a business plan that comes with it. And if we want to shift anything there, we need to adjust the business plan. And what we have here, you'll see the movements for that NTSG moves is exactly the same. It is just that we are using the money in the business plan and shifting it in accordance with the line items that we got in the adjustment business plan. So it's a technical exercise. But because it's a business plan, it's conditional grant, we have to then shift from one item to the other. And that's the only thing. It's a neutral balance between those numbers. And then in relation to page 107 for the nursing post, these are 3 posts in the West Coast office. And just explain to you how that works. We have people that needs to come for training all the time under the nursing college. So we have to release staff in the services. And while they are going for their training to upskill themselves, we have a release sister or nurse that goes and fill in for them at their places. This specific thing is that in this process, we've lost the ability of those 3 posts. We are compensating for that through other means. So it is also a small number of posts because we have a broader pool of posts that actually does relief across our area as well. Member van Wyk, you're right, the 15 million that does come in helps us with the service pressures in program 3 in terms of the ambulance response times. But a lot of this money is already going into that we don't have to reduce service levels. It's maintaining service levels with a view that in future we need to look and build up from there. Chairperson, I hope that answers all the detailed questions.
Thank you, HOD, and thank you, Minister. Members, any follow-ups for more clarity? Going once.
Yes,
Going
Chair.
twice. You may follow up, Member Van Vogel.
Yeah, Chair, mine is just a comment on the answers. Ek hoor wat die HOD sê in terme van die vacancies en die filling of vacancies. Vir my is dit ek is vir my onaanvaarbaar because ons mense daar buite by clinics, hospitals, the first issue is this shortage of staff. Ons het 'n probleem wanneer dit kom by personeel om ons mense te diens. En hier sit ons met geld geld waar ons mense kon aanstel, waar ons personeel kon aangestel het. And because of a process, and I'm actually happy that he mentioned that there is a type of engagement with
EPSA.
EPSA when it comes to advertising and filling posts. So for me, for now, it's unacceptable because our people don't see all those processes. They want services, and that's what we need. Services, people who serve them. And dis wat ons nodig het hier by ons hospitals, ons clinics. So dis net 'n comment wat ek wil maak op die verduideliking van die HOD, sowel as die MEC. Dankie, Chair.
Thank you, Member Van Vogel. Minister, I see your hand is up.
Thank you, Chair. I'd actually like to appreciate the comment from Honourable Van Vogel because, you know, we have the same frustration about being in this situation, and perhaps the committee could help us through a recommendation which would help strengthen our arguments as well, because we can all see the effects of some of these regulations. While we understand that it is needed, across the public service generally, in a frontline service department like health, it has unintended consequences. Thank you.
Thank you, Minister. That is noted. We will definitely make a note as one of the recommendations for that. Members, I don't see any further hands. Monday, if you can then start paging again. Now on page 109, page 110. Sorry, Monday, there's a hand, Member Van Vogel. May go ahead, Member Van Vogel.
Thank you so much, Chair. Perhaps I'm a bit slow. My last question on page 107, before moving to page 09, the last row.
You may go ahead.
Can
member.
I continue? Okay.
Yes, you may.
Yeah. What we noted there, Chair, is that there's an amount of 49.5 million, and it's been redirected to other projects. And with the explanation being that predominantly due to reallocation and reprioritization or slow progressing projects. Could you clarify, could the department clarify what this means and how many projects were affected and what are the reasons for the slow progress? And how does this process work and what criteria is used to determine the funding adjustment? Then if I can move to page 109, program 8, health facility management. Could the department also explain the reasoning behind this decision? Why has these funds been reallocated to the 25-26 financial year? Were there challenges that prevented full expenditure this year, or is this reallocation due to a delays in projects? Or does it reflect progress in national government effort to address load shedding effectively? Then lastly, on page 109, we acknowledge the additional allocation of 233 million, which will primarily be used to partially address in-year service delivery pressure. In this funding part of the 230 million from the Provincial Revenue Fund that the MEC of Finance referred to in a budget speech. Additionally, could you clarify what specific service delivery pressure the department is addressing with this allocation? And also what criteria is used to identify the hospitals and other facilities that will benefit from these funds? Thank you, Chair.
Thank you, Member. Minister, over to you and the team.
Thanks. I'll ask the HOD to come in here, please.
Thank you. HOD, over to you.
Thank you, Chairperson. Just to clarify on page 107, what Van Vogel was asking. So we have a schedule of projects that during the year we have to spend money on the project. When we come to about October, November, we do an analysis of what our speed of expenditure against those projects are. And then based on the individual factors at each one of them. So this might vary from a contractor being late on the milestones. It might vary to weather interrupting some work. It might vary. So it's a range of things. We're quite happy for Dr. Laura Angeletti to give the detail of what those items are. So if that's acceptable to the committee, we're quite happy to give you the detail of what those delays are on page 107. If it goes to 109, just to clarify, because I tried to look at 109, just for Member Van Vogel, the numbers on 109, when it says health facilities management, These are shifts between funds, right? So what this is actually it's money that we're doing for solar panel investments, but it is because it is to buildings, we're actually transferring the money to infrastructure to make sure that we have solar panel investments. So just to clarify that it actually is to do things. It is just that the buildings belong to infrastructure. We give it to them to install it in the places where we need it. Then the bigger question on page 109 is what is the service pressures that this bulk of this 197 goes to, as we've explained, or the 230 that comes in with the movements out. The bulk of that, as you will see, lies in both equipment, that's why we call it machinery, and more importantly, in goods and services. So if I can explain to you what has happened with goods and services. Goods and services in a place like Grootske and Tygerberg is about getting medical supplies, it's about getting surgical supplies, it's about getting medicines, it's getting laboratory tests, all of those things. So the service pressures that we've had for goods and services and this higher than normal inflation has meant that our supplies at our bigger hospitals had to run down to a very, very tight window. So supplies normally means we have enough stock for about 3 months. That means you're not at the risk of running out. The place like Grootske had to bring that down almost like to 3 to 4 weeks. What this allows us now is to take this money and put that numbers of supplies into safe areas again. So we just adding this because this money helps us to put enough supplies for us not to be at the risk of running out of supplies for that. Secondly, it is that we've had to delay equipment being purchased. And, you know, when you do fancy surgery and whatever, you can have a breakdown of equipment item at any given time. So it's important that we then get the right equipment and do safe medical care for people. So it's in most part, the money that is coming additional into that is ensuring that we have supplies and ensuring that we have the necessary equipment to continue to do good quality care wherever we need it in the system. Thank you, Chairperson.
Thank you, HOD. Any follow-ups, members?
Yes, Chair.
Yes, you may, Member Van Vogel.
Yes, then does it mean if I listen to the HOD, he mentioned Grootske. So are you going to use the money? Because my question was also, how do you identify which hospitals will benefit from this funds? So are you saying that it's going the money will only be directed to Grootske? So I just need clarity on that issue, Chair, because I wanted to understand which hospitals or which institutions will benefit from that when it comes to services, service deliveries. Please, Chair. Thanks.
Thank you, Member HOD.
So what page 109 shows, Chairperson, sorry about that, Member Van Vogel, I understood your question. I use Grootske as an example. If you look at the amounts of the 233, the ones you spoke about, it goes from program 1 to program 6, and you will see that the bulk of that money is 118 million for central hospitals, and that is divided between Grootske, Tygerberg, and the Red Cross. But you will also see a big amount of 62 million, which is for metro and rural district health services, mainly to the bigger hospitals in those areas, but also to primary care facilities. You already see also the 15 million for EMS, for emergency services. And then also in program 4, which is for regional hospitals and psychiatric hospitals, 12 million. So it is spread, Member Van Vogel, across our institutions. The ones that uses the biggest amounts of goods and services will have a disproportionately higher. The ones that has less goods and services will use proportionately less. But it's definitely spread across all our service platforms, from clinics all the way to central hospitals. Thank you, Chairperson.
Thank you, HOD.
Thank you.
Thank you, colleagues. Nomonde, you may, page. We're on page 110. 111. 112. 113. 114. 115. 116. 117. 118. 119. 120. 121. Colleagues, I think that is the crux of the pages. What follows from 122 are the rest of the annexures. And I take it that we did go through it. If anybody has got any other issue to raise on these pages or on the pages of the annexes, you may refer to the page. Or other than that, I will take it that we have exhausted the core matters in front of us. Going once, going twice, it is going thrice. But members, as I've said that, nothing stops us after this process, to write to the department for any clarifications in one of the standing committees going forward. We would then do so. And then in this current exhaustion of any engagements regarding from page 101 to page 122, can I then allow the minister and the HOD to make their closing remarks? Or before I do that, Nomonde, I'm not sure if we have members of the public might have joined us. Because if we do, the members of public, I'm now allowing an opportunity for them to quickly also engage if we do have members of the public. I don't see on my screen, Nomonde, I don't know whether you can observe anything.
I don't see it, Chair, on my screen as well.
All right, thank you for that. In the absence of members of the public, can I then give over to the minister, and then thereafter, minister, you can give over to the HOD to make your closing remarks, please.
Thank you very much, Chair, and let me express my appreciation to the members for the questions and digging into the budget book and to understand how we've strategically managed or would like to manage the adjustment appropriation. Yes, thank you very much for the constructive engagement.
Thank you, Minister. Over to you, HOD.
Thank you very much, Chairperson. Just to reiterate what the Minister said, we really appreciate and we value our engagements with this committee. As you indicated, we are willing to respond to any questions, comments from the committee. And we really for this morning also commend you and the committee for doing your oversight. As I always said to you before, we humbly stand to account. Thank you very much, sir.
Thank you, HOD. From my side, Minister and HOD, thank you very much to you, Minister, and your team. It is really a pleasure to engage with the department. And I've noticed, Minister, as well, even with the engagements between the department and the public. I've been copied in on the emails and I've been copied in on the responses. I must say that it is really, it's a pleasure to see the professionalism within the department. And we know that the pressures are massive. And thank you for giving the best under the circumstances. Minister, you and your team, you are excused. And we will see you in the House sometime next week. You are now excused, Minister, HOD, and the rest of the officials. Thank you very much. Giving them a
Thank you.
minute.
Bye-bye.
Thank you, Minister. Celia. Members, thank you very much. Can we then continue with the business of the committee? Can we quickly then deal with some of the recommendations that came out of the deliberations? I know Member Van Vogel raised a pertinent matter, and I don't know, Nomonde, if you have professionally on our behalf structured that, and that is, as I can probably remember at this stage, that is the support to the department with their engagements with the DPSA when it comes to the filling of vacancies. But I don't know how to word that properly, Nomonde. If you didn't do it as yet, we can then, you can just find a way to structure that. Members, are there any other recommendations that you can think of? I think then the second recommendation was also raised by Member Van Vogel, and I think it's with regards to page 107 regarding the shifting of funds because of slow progress. If we can then get a detailed report on the affected programs that has been affected due to the slow progress and then the shifting of the funds. Because of that, if we can then just get the details of those programs. I don't know, members, if there's any other. I can remember only these two recommendations. I think that is it for now. If anything comes up, members, we can then also then deal or submit that. Members
Sorry,
can...
Chair.
Yes, no
Sorry,
more.
Chair. With regards to the recommendation on page 107 that you just referred to now, you said detailed information on the affected programs due to slow progress. Is it the appointment, the recruitment process, or
let me just
what are
go
you
there.
referring to?
It's projects. It's
okay.
regarding
Oh,
projects.
infrastructure.
Yeah.
Oh, okay. Thanks, Chair.
Rectifying that. All right, members, we have now reached a point where we have dealt with the deliberations of the appropriations of vote 6. Can I then now open the floor to the members on indicating on whether we support the appropriations of vote 6 and or whether we have any other comments regarding vote 6? I see Member Van Wyk, your hand is up. You may.
Yes, Chair, I think, if we look at the overall pressures that this department has and has had, and, as standing committee, we are well aware of that. We certainly need to commend them for work that has been undertaken and obviously the involvement here of Provincial Treasury in getting more funds appropriated to them to go forward. I've just had a look at the overall picture in terms of the overall funding for this year compared to last year, and it's a 3.5% increase. So it's you can indicate how, that indicates how tight the fiscal constraints are, and accordingly, I would like to support the adjustment appropriations that we are dealing with today. Thanks, Chair.
Thank you, Member Van Wyk. That is noted and recorded. Member Walters, I see your hand is up.
Chair, just to support Member Van Wyk's proposal that we support the vote.
Thank you, Member Walters. I see Member Van Vogel, your hand is also up.
Thank you, Chairperson. Chairperson, in accordance with Rule 19, the ANC minority position is to not support this budget, and we request that this position be formally recorded. We have significant concerns regarding the unearmarking of the 193 million from the provincial equitable shares within the infrastructure budget. Furthermore, we are deeply troubled by the redirection of budget allocation for compensation of employees to fund goods and services. This approach, while perhaps addressing immediate pressure, risks undermining the quality of care and service delivery. The most significant impact will likely be felt in poor and working class communities where healthcare staff shortages are already a pressing issue. We urge the department to reconsider these decisions and provide assurance that these reallocations will not exacerbate the challenges faced by the healthcare sector. Thank you, Chair.
Thank you, Member Van Bossel. Members, any other hands? In the absence of that, it's going once, twice, thrice. Members, please then allow me to read the report of the committee. And it reads as follows. The report of the Standing Committee on Health and Wellness on vote 6, which is health and wellness, in the schedule to the Western Cape Adjustment Appropriation Bill, which is B2/2024, dated the 29th of November 2024, as follows. The Standing Committee on Health and Wellness, having deliberated on vote 6, health and wellness, in the schedule to the Western Cape Adjustment Appropriation Bill, in brackets B/2024, close slash, referred to the committee in accordance with Standing Rule 188, reports that it supports the vote. We also have a minority view in terms of Standing Rule 90. The African National Congress expressed its minority view to not support the vote. Members, this is what will be submitted to the House. And I'm sure that sometime next week, there will be further deliberations in the House when this process has been concluded of all the votes. Thank you very much for your participation. And the meeting is now adjourned.
Thank you, Chair. Goodbye.
Thank you, colleagues. Cheerio.
Thank you, Chair.
Pleasure. Cheers, guys.
Thank you, Chair.
Sanchez.
Thanks very much, Chair.
All right, Member Van Beek, thank you. Cheers, guys.